First up this afternoon at 4:30, breaking news on the coronavirus outbreak. Yet another very busy day here in the Eyewitness Newsroom. Health officials have confirmed a third case in the state. The latest patient is an elderly man from New Canaan.
And we are told that that patient had no known contact with the virus, and they are still trying to trace the source. Also, this is big. Just in the city of New Haven is closing schools due to a suspected case. A news conference will be held within the next half hour, and we will bring that to you live.
And as we learn more, we will pass it along to you, that's for sure. The state is focused on testing people now who have returned home from international travel. So far, we're told 74 people have been tested. 3 people, as you know, have tested positive. 71 tests have come back negative. We're told 16 are still pending.
All of this comes as the World Health Organization officially classified COVID-19 as a pandemic, meaning there is significant human-to-human transmission. 31 people have now died in the United States from the virus, and there are more than 1,000 confirmed cases here in the U.S.
So right now, controlling the virus and slowing down the rate at which it spreads is really the main focus.
Definitely. Chief Capitol reporter Susan Raff live for us at the Emergency Operations Center at the State Armory, where a press conference wrapped up just a short time ago. And Susan, there were a number of new developments.
A number of new developments. You know, Governor Lamont has declared a public health emergency. That was yesterday. He was not at this particular briefing today, but his chief operating officer was, and many agency commissioners, all of them stressing the need that Connecticut needs to be vigilant. And as you mentioned, yes, at 3 o'clock this afternoon, a third case, a confirmed case of the coronavirus, has been detected here in Connecticut, an elderly man who lives in New Canaan. And of course, many questions as to how he became infected. All those still need to be answered. One of the things that they also stressed here today is that many people are concerned. They may feel that they have the flu, a cough, or some type of cold, but that's not necessarily a good idea to rush to the hospital.
If you have fever and a cough, for example, and you are in the southwestern part of the state, you should assume that you have COVID-19. You don't need a test to tell you that that's what you have. You should assume that that's the illness that you have. Most people will get better at home, especially the younger you are. That will be the case. You should talk to your physician. They can provide you advice for how to care for somebody with COVID-19 at home.
Dr. Matt Carter, who is Connecticut's state epidemiologist, says people need to be aware of that they can recover at home. He says more than 80% of people who become infected with coronavirus can recover at home, but you should check with your doctor first. As you know, lawmakers have been very concerned about this. They met with the governor earlier today, and they had their first meeting since he declared this public health emergency. We should also point out that Connecticut is going to be getting more supplies. Some 500,000 plus masks will come next week, hopefully, and we are told the federal government is going to give some $7.1 million to Connecticut to help us stop the spread of the coronavirus. And coming up on Eyewitness News at 6, what lawmakers talked about today. Are they supportive of the governor's action? And obviously they are taking actions of their own in light of all the school closings here in Connecticut. We are live at the Emergency Operations Center in Hartford. Susan Raff, Channel 3 Eyewitness News.